What is a lateral meniscus injury like the one suffered by NBA star Joel Hans Embiid? Medium. Joel Embiid is establishing himself as one of the NBA's most dominant players, presently leading the league in scoring with a performance that mirrors his past MVP victory. After winning the Most Valuable Player award last season, Embiid continues to demonstrate an extraordinary combination of abilities that has the Philadelphia 76ers leaning on his broad shoulders. His skill goes beyond standard play with an elite adaptability that draws similarities to some of the game's legends, including as Kobe Bryant's shooting prowess, Shaquille O'Neal's dominating force, and Hakeem Olajuwon's smart footwork. Embiid, who stands 7 feet tall, redefines the center position with his quick movement, basketball intellect, and uncommon shooting touch given his stature. His trajectory leads straight to the Hall of Fame as he continues to alter the expectations of a modern NBA center. The enormous pressures placed on the knee joint during basketball actions such as jumping, cutting, and rotating make lateral meniscus injuries quite frequent among athletes, especially those who play in the NBA. A misplaced flap tear of the lateral meniscus is a form of meniscal injury in which a fragment of the meniscus tears and moves to an aberrant position, resulting in mechanical symptoms and knee dysfunction. Symptoms of a misplaced flap tear of the lateral meniscus generally include pain along the knee joint, especially on the outer lateral side, swelling and stiffness in the knees, the sensation of the knee catching, locking, or giving way, especially when twisting or bending, limited range of motion due to mechanical obstruction caused by the displaced meniscus fragment. Diagnostics. A lateral meniscal tear, including a misplaced flap tear, is often diagnosed as follows. Clinical examination. The doctor will obtain a medical history and do a physical examination, with an emphasis on the knee's range of motion, stability, and tenderness. Imaging tests. MRI, magnetic resonance imaging. This is the most sophisticated imaging test for detecting meniscus tears. It produces clear images of both soft tissues, such as the meniscus and bones. X-rays. Though X-rays cannot reveal soft tissues like the meniscus, they can rule out other reasons of knee discomfort, such as fractures. Treatment for a misplaced flap tear of the lateral meniscus varies according to the severity of the tear, the athlete's level of activity, and the existence of concomitant knee problems. Options include conservative treatment. To minimize pain and swelling, the initial treatment may include rest, ice, compression, and elevation, RICE, as well as non-steroidal anti-inflammatory medicines, NSAIDs. Physical treatment can also help strengthen the muscles surrounding the knee and enhance its function. Surgical treatment. Surgery may be advised for athletes, particularly if conservative treatments fail to alleviate symptoms or if the tear produces considerable mechanical problems. Locking, catching. The most popular techniques include meniscectomy, removal of the damaged meniscus. This is more common with tears that cannot be healed. Meniscal repair. The meniscus's torn margins are sutured together. This is preferable if the tear is repairable since it saves meniscal tissue. Surgery and recovery. Surgical procedure, both meniscectomy and meniscal repair, are usually performed arthroscopically, with small incisions and a camera to guide the procedure. This less invasive method shortens healing time and alleviates post-operative pain. Rehabilitation. Following surgery, rehabilitation is critical. It usually includes exercises to increase range of motion, strengthen the knee, and eventually resume athletic activity. Return to play. The time frame for returning to play varies. A meniscectomy allows athletes to return to sports in 4 to 6 weeks, whereas meniscal repair may take 3 to 6 months, depending on the amount of the surgery and the individual's healing reaction. Prognosis. The prognosis for athletes with a displaced flap tear of the lateral meniscus varies depending on the therapy and severity of the injury. While meniscectomy allows for a faster return to sports, it may raise the risk of future knee problems like osteoarthritis. Meniscal repair, which aims to preserve meniscal tissue, provides a better long-term outlook for knee health, although with a lengthier recovery period. In the case of NBA players, the emphasis is frequently on both a rapid return to play and the long-term health of the knee, weighing the need for surgery against the benefits of conservative therapy and rehabilitation. The exact recovery timetable and prognosis are determined by the athlete's unique injury, treatment option, and response to therapy. Disclaimer. The information provided regarding the lateral meniscus injury, specifically a displaced flap tear, and its implications, treatment options, and prognosis, is based on general medical knowledge and should not be construed as specific advice or diagnosis for Joel Embiid or any individual athlete. The mention of Joel Embiid suffering an injury in a game against the Warriors after an incident involving Jonathan Kuminga landing on his left leg is derived from reports, including an athletic report suggesting a possible left knee lateral meniscus displaced flap injury. We do not have any affiliation with Joel Embiid, the NBA, the teams involved, or direct knowledge of his medical condition. This content is for informational purposes only and is not intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition.